Stage. Organizer, it's Alafra Group. I think it's heartening to see that lay people like this Alafra Group understand the quantums of the problem of health issues in our country, in particular Northeastern India. I have been associating with this Alafra Group for the last 3 years, and first summit and second summit, this third summit. And I was nearly missed because I just landed from Bhutan and just directly came from airport. And 1 week I was interacting with the high-profile people of Bhutan about health issues, and visited a couple of their centers. I was so impressed with their health system, the national health system, which India should have been taking lead, but I think Bhutan is late in many ways. Even primary healthcare is one of the first country in the South Asian region to implement, and it's very well working. And when you look around our scenario, when you talk about health, I think everybody is talking about health, whether individual or organizations or hospitals, we always think about health. But when you look around inside the process of health, what are the ill healths existed in our system? I thought I'll reflect a few words. I know all of you are very tired. 2 days you have been doing a lot of exercises. And I think subject choosing is very, very important. I would like to congratulate Alafra Group again that shaping the health issues of Northeastern India. I think it's high time to think about. Why we have to think about is because when I look around, about 65% of the super care or specialized treatment from the Northeastern India still go out of this region. The amount of money, if you calculate the so-called out-of-pocket expenditure by the people of Northeastern India, is huge. Let me ask you, do we lack in our manpower resources? No. We have best doctors, surgeons, or physicians, or whatever may be. We do also have. And are we deficit in having the infrastructures? In a way, yes. But I think for last 5-10 years, it has been striving very hard to develop the state-of-the-art hospitals in this region itself. And we are proud of it. And the government of India is not spending on health? Yes, they're spending a huge amount of money. It's a huge amount of money. But then why do our people still go out of region and seek for the better treatment outside the Northeastern India, spending huge amount of money? If all these amounts would have been circulating in our region, I think our economy would have been much better. So I would like to congratulate those private hospitals and the government hospitals striving hard to give the quality of care. Where the illness comes now. Let me talk about illness. The issue of the ill health relates to the past and the present and the future, especially in Northeastern India. Past, how it was. Though we had a limited technology, hospitals are very few, the quality of service were good. There was a humanity touch. The profession was not commercialized. I think profession was primarily focus on the treatment and the giving a human touch. That is the reason in the past healthcare was, I think, at par with the rest of the standard in the country. So, what happened? In the health, ill health started is when technology advances, the healthcare system started to be commercialized. I think target was a profit making. So the competition started among the players, whether private or government or a state or a country. I think when the competition started, what happened, the psycho of the people, they also need a quality of service. The money you pay, I think the quality is also, the amount of quality also increases. This is how the issue came. This is how the people are running from one hospital to another hospital and one doctor to another doctor in search of a quality service. And when they don't find, they go out of the northeastern India. When they don't find, they go out of the state. When they don't find in that district, they go to the state level and then the regional level and outside the state. This is a major issue. Today, we are at the crossroad. Quality versus commercialization. Now I'm so happy that H&FW Group has given a vision that how to save the health of the northeastern India. I think we really need to congratulate them because though they are lay people, yet they realize the need of healthcare, and this third summit has brought out the crux of the issues in our healthcare systems. And I think it's an eye-opener. I'm sure that I guess that many of our colleagues who have been here today, so that I think they have I don't want to, because time is very, very, exhaustive. Even I have to now go to Ceylon. Tomorrow I have a very important program. I think I don't want to say much. Now, in spite of all these things, I just want to inform you what India is not doing, or in a sense, what India is trying to do for the healthcare systems. Despite of quantum jump and every sphere of health sector, out of expenditure, pocket of expenditure, estimated, just recently concluded the National Health Summit, I said, in Hyderabad, I was at Tirupati. The huge amount of 65%, the health burden is due to the out-of-pocket expenditure, 65%. And 68% Indian population still live in a rural area. They are deprived of the healthcare. One gentleman was sitting here, I think Seva Bharat Sansthan. He has, I think he's not even a professional person, but just came to throw a light that the remote and rural area people are still in service, healthcare service. 68% are people who live in the rural area, we don't have. 3 years I was in the Northeastern Council trying to go around and find out what's really going on. We are really doing something for our region. And after 3 years completion term with them, for last 8 years I'm sitting as Director of Regional Resource Center, which is a technical wing of Ministry of Health for National Health Mission, looking after 8 states, trying to go around from the sub-center to the medical college, trying to find out myself. 6-7 months exercise I've done, I found out most of the rural areas are deprived of the basic health care. In the 60s, there were doctors in the so-called primary health center. Today, in 2016, we don't have doctors and nurses over there. What happened? This is a challenge I want to put across to you. Now, though marginally, infant mortality rate in India has decreased, but is still much, much higher than a small country like Bhutan, or talk about Sri Lanka or Maldives, even Bangladesh. Can you imagine? Infant mortality rate is still high. And you look around in northeastern India, though I think Sikkim and Mizoram has achieved the reachable target, and 2013 and 14 SRS report says it is marginally came down, but states like Assam and Meghalaya are still too high. So I think it's even Assam is much higher than even national average, and it's a matter of great concern. Maternal mortality, for example, it is 301, very, very high. Total fertility rate in northeastern India is, some of the states is very, very high. Against 1.28, I think northeastern states, some of the states we have 2.9, very, very high. So today one of the major burden, the healthcare burden we are facing is that 60% of death is due to non-communicable diseases. Now, emergence of non-communicable diseases challenging our entire healthcare systems. And we are still sleeping. I think the Northeastern has to wake up that there is emergency of the emergence of non-communicable diseases. For example, you talk of cancer. I think highest cancer prevalence is Northeastern India, especially Mizoram, and followed by probably Arunachal Pradesh and Nagaland, even in Assam, I think. And you talk about other non-communicable diseases like now heart diseases, diabetic is one of the, I think, emerging issues in Northeastern India. We have to really think twice, those who are in the healthcare systems. And roughly 5.8 million Indian people die of the non-communicable disease. And Northeastern India is not exceptional. I think today the mortality in the non-communicable disease is much higher than the infectious diseases. We have significantly controlled infectious diseases, but I think non-communicable diseases has to be addressed. Now, what is the major problem we are facing today? The major problem facing is we are not able to converge together. Now, public health issues today, for example, National Health Mission, it is comprising previously called National Rural Health Mission. Today, I think it is National Health Mission is composed of National Urban Health Mission and National Rural Health Mission. Now, 60%, more than 80% of National Health Missions is, I think, taking care of the entire health systems. And now only, just few years, just last 2 years only, the government of India is trying to understand the importance of public health. Aren't we really segregating from public health and the curative? This is one of the major problem what I find, that the curative service providers are too busy with only curative aspects. We have no time to think about public health. Tamil Nadu is the only state in the country that the public health cadre has been formed, and I think they are today the health indicators are, I think, is going to be one of the best in the country. we are not able to understand the situation, the quantum of the problem. And our health expenditure by Government of India is only 1.5%. I think it's one of the lowest. 1.5% GDP spent by Government of India on health. And for a northeastern India, especially if you see the states, it is less than 1% we are spending. Then if this is the scenario, how do you expect that our health standard is raised? We talk about health, then I find in the process of health we find a lot of ill healths. How can bridge together? Only solution I find is today is time for us to realize, realistically realize that we have to have the hand holdings. Government and private should come together. When I was in NEC, I was emphasizing the importance of private players in northeastern India. And I think one of the subject experts, they requested me to be again to do some studies. Probably I'll be coming forward, how important the private players are. So can we really take part in the activities of the national health programs? Because privates are too busy with the only private curative services. I think we need to come forward to do the also the community or preventive aspects also. Number one. Number two, I think we really need to work together also. It's not only that preventive aspect is only should not be done by government. Indian health public standard should not be applicable only to the government system. It should be applied to the private also. And our target is to give the quality of service. And you are talking all about quality. Now, Government of India, through National Health Mission, we are also emphasizing the quality of services. And Government of India has taken a lot of initiative today, and pre-diagnostic and pre-drug distributions. And in a way, how can you incorporate, how can we private players also be benefited? Before, I think at lunchtime I was talking with a few of our friends that in the private players also has every right to ask government to incorporate a national health mission in embarking the activities of national health mission activities in our country. So private players also have every right to get the facilities what the government is giving. Government of India has given a lot of money to the states. And why the state is only confining to the government system of hospitals? This is one, can this forum recommend and to the government of respective state or government of India that private player also need to be involved in the activities of this national health mission. With these few words, I would like to say a few words that unless and until we come together and we strengthen our community, primary health center, sub-center and district hospital, and unless and until we do scale up and pre-drug distribution, pre-diagnostic and health and wellness center, screening for STD, what Government of India under National Health Mission is giving free. And if this also can be benefited to the private players, I think we can do tremendous work, and we can cut the out-of-pocket expenditure. And our patients should no need to travel to the Chennai or Delhi or Bombay and Calcutta. I think we can treat our patients in no distance itself. With these people, I'd like to thank you again, and probably I think I'm too late to come to you. I should have been with you. With these people, I'd like to thank you once again. Thank you.
Thank you very much.